If you have diabetes, stop right there before you open another tab. I need you to do something for me right now. Just pause and notice your body. Start with your feet. Is there any tingling right now? Any burning? Any numbness? That strange feeling like your feet are wrapped in layers of cotton, even though they are sitting in your shoes or resting on the floor? Now move your attention up to your hands. Any odd sensation there? A kind of weakness when you grip something? A dullness at the fingertips? Now bring your attention to your mind. When did you last feel truly sharp? Not just okay, not just getting by, but genuinely clear-headed, focused, like your thoughts were quick and clean and easy to follow. And be honest with yourself, because this matters. How many times this past week did you forget where you put something? Walk into a room and completely forget why you went in there. Read the same paragraph twice and still not absorb it. Lose a word mid-sentence that you absolutely know. And the fatigue, not just normal tiredness, that deep, heavy bone-level exhaustion that sleep does not fix. That feeling of dragging yourself through the day, even when your numbers look acceptable on paper. Here's what I want you to know. Most people living with type 2 diabetes assume these symptoms are just part of the deal. They think it is aging. They think their body is simply deteriorating and that this is what the rest of their life looks like. But what if there is another reason? What if your body is actually starving for specific nutrients it needs to keep your nerves working, your brain clear, your energy stable, and your blood vessels healthy? And nobody has ever explained that to you because there are 3 vitamin deficiencies that quietly become extremely common in people with type 2 diabetes. And the symptoms overlap so closely with aging that most people never connect the dots. Today, I am going to walk you through all 3. I will show you exactly how each one affects your body, why diabetes specifically makes these deficiencies so much more likely, what the warning signs look like, which foods and supplement forms actually help, and one critical mistake that makes many supplements almost useless even when people take them every single day. That last part is something most doctors never explain, and it genuinely changes everything. So stay with me because what I am about to share could shift how you understand your health from this point forward. I am Dr. Megan Foster. I have spent decades working with patients managing diabetes, nerve damage, circulation problems, inflammation, and metabolic disease. And if there is one thing I see over and over again, it is this. Most people believe diabetes is purely a blood sugar problem. Control the glucose and everything else takes care of itself. That is a misunderstanding, and it is one that leaves millions of people suffering unnecessarily. Here is the reality. High blood sugar does not just affect glucose. Over time, it creates a kind of ongoing metabolic stress inside the body. It increases inflammation. It damages the inner lining of blood vessels. It disrupts the way cells absorb and use nutrients. And because of all that, the body burns through certain vitamins and minerals much faster than it normally would. Meanwhile, diabetes medications, changes in digestion, declining kidney function, and restricted diets all reduce how well the body absorbs those same nutrients in the first place. So you end up in a situation where the body needs more and absorbs less. That gap is exactly where deficiencies quietly develop. And when they do, the body starts sending signals. Fatigue that does not respond to rest, nerve symptoms in the feet and hands, brain fog and slow thinking, low mood and emotional flatness, slow healing of cuts and bruises, poor sleep quality, muscle weakness and cramping. People assume their body is simply aging. Sometimes it is, but sometimes underneath all of that, there is a nutrient gap that nobody has identified or addressed. That is what we are talking about today. I want you to think back for a moment, 10 or 15 years ago. Maybe more, maybe less, depending on when you were diagnosed. Remember when your energy was more consistent? When you could get through a full day without that mid-afternoon crash? Remember when your mind felt quicker? When you could hold a train of thought without losing it midway? When you slept through the night and actually woke up feeling like you had rested? Now compare that to where you are today. Maybe your blood sugar is technically managed. Maybe your doctor says the numbers are acceptable, but your body still does not feel right. Your feet feel strange at night. Your hands feel off sometimes. Your memory is not what it was. You do not feel sick enough for people to notice from the outside, but you also do not feel like yourself anymore. That slow, quiet decline is one of the most frustrating things about living with long-term diabetes. Because the numbers on paper can look acceptable while the person behind those numbers is quietly struggling every single day. And most of the time, nobody explains why. Here is what I want you to understand. This is not always inevitable. This does not automatically mean your body is permanently damaged or that gradual decline is the only trajectory. Sometimes the body is depleted. And when the right deficiencies are identified and corrected, people are genuinely surprised by how much better they feel. Not overnight, not like flipping a switch, but noticeably, steadily, meaningfully better over weeks and months. That is what we are working toward today. Let me give you a simple way to think about what is happening inside the body when these deficiencies take hold. Imagine your body is a house, and running through every wall of that house is a complex electrical system. That system controls everything. The lights, the heat, the appliances, all of it. Now imagine that over time, the wiring in some parts of the house starts losing its protective coating, and the power supply coming in becomes slightly inconsistent. Things still work most of the time, but not quite correctly. Some lights flicker, some rooms stay cold no matter what you do. Some appliances take longer to respond. Some signals just do not get through at all. That is what vitamin deficiencies can look like inside a body dealing with diabetes. High blood sugar creates a slow, ongoing metabolic stress, almost like a current that never fully turns off. Nutrients that the body depends on for nerve function, brain signaling, energy production, and blood vessel health get used up faster than they can be replaced. And when those levels fall too low, the body's electrical system begins to struggle. This is not speculation. Multiple large research studies have confirmed that vitamin D deficiency is significantly more common in people with type 2 diabetes than in the general population. Long-term research involving thousands of diabetic patients has shown that one of the most widely prescribed diabetes medications is associated with declining vitamin B12 levels over time, and there is now strong evidence that deficiencies in vitamin D, B12, and folate affect nerve health, inflammation levels, how well the body responds to insulin, blood vessel function, and energy metabolism at the cellular level. This is why more physicians are beginning to look not just at blood sugar, but at nutritional status as part of comprehensive diabetes management. Before we get into each vitamin individually, I want to explain something that most diabetes conversations completely skip over. It is one of the core reasons why these deficiencies develop in the first place. And understanding it will help everything else we talk about today make much more sense. It comes down to two things that happen inside the gut. When blood sugar stays elevated over long periods of time, it can affect the health of the digestive tract itself. The cells that line the gut are among the most rapidly replacing cells in the body. They need to be refreshed constantly. When those cells become inflamed or compromised from ongoing high blood sugar, the gut becomes less efficient at absorbing nutrients from food. This means that even when someone with diabetes is eating a reasonably good diet and taking supplements, their gut may simply not be absorbing what they think it is. The nutrients are there, but the gut cannot do its job properly. At the same time, many people with diabetes experience something called slowed gut movement. This happens because high blood sugar affects the nerves that control how the digestive system moves food along. The same nerve damage we associate with tingling in the feet can also affect the nerves inside the gut. When food moves too slowly through the digestive tract, bacteria can break down certain nutrients before the body has a chance to absorb them. This particularly affects B vitamins. And then there is the stress hormone connection. Most people do not think about stress when they think about nutrient deficiency, but the link is real and significant. When the body is under chronic stress, it produces a hormone called cortisol. Cortisol is useful in short bursts. It helps the body handle emergencies. But when stress is ongoing, as it consistently is for people managing a chronic illness like diabetes, cortisol stays elevated for far longer than it was designed to. And one of the things that chronically elevated cortisol does is increase how quickly the body excretes certain nutrients through the kidneys, particularly vitamin D, B vitamins, and magnesium. At the same time, ongoing inflammation, which cortisol contributes to when it is chronically elevated, actually increases the body's demand for those same nutrients. So, the situation is this: the body is losing more nutrients than normal through excretion. It is absorbing less than normal due to gut function changes, and it is needing more than normal because of the increased demands of inflammation and metabolic stress. That triple burden is what makes nutritional deficiency so common in people with diabetes, even in people who are eating thoughtfully, exercising regularly, and genuinely trying to manage their condition well. This also explains why food and supplements alone are not always enough once a significant deficiency has developed. The gut has to be functioning well enough to absorb what you eat, and the overall inflammatory and stress burden matters alongside the supply of nutrients. This is the bigger picture that most conversations about vitamins completely miss. So in this video, we are going to go through the 3 most important deficiencies one by one. We will start with the one most strongly connected to fatigue, immune function, and how well the body responds to insulin. Then we will move to the one that may be silently worsening nerve symptoms, especially in people who have been on metformin for any length of time. And finally, we will cover the 3rd deficiency, the one that most people with diabetes have never heard connected to their condition, and the one that surprises almost everyone when I bring it up. Before we go further, if you are watching this and living with diabetes, drop a comment right now and tell me what symptom is bothering you the most lately. Is it the fatigue, the tingling in your feet, the brain fog, the sleep problems, or something else? Leave it below. You will very quickly realize you are far from alone in what you are experiencing. Now, let us get into it. The first deficiency is vitamin D. Most people think vitamin D is mainly about bone health, calcium absorption, preventing fractures. That is where the public understanding usually stops. But vitamin D does far more than that. It behaves in the body more like a hormone than a typical vitamin. It communicates with cells throughout the body and influences hundreds of different biological processes. And one of the most important involves insulin, which is at the very center of what goes wrong in type 2 diabetes. Research has shown that vitamin D plays a direct role in supporting the cells in the pancreas that produce insulin. It also affects how sensitive the body's tissues are to insulin, meaning how well the cells can respond to insulin's signal and bring glucose in from the bloodstream. When vitamin D levels fall too low, that process becomes less efficient. The pancreas struggles to produce enough insulin, the body's cells become more resistant to it, and blood sugar control becomes harder, even when everything else is being managed correctly. But there is more. Vitamin D is deeply involved in regulating the immune system and controlling inflammation. Chronic low-grade inflammation is now understood to be a major driver of many of the complications associated with long-term diabetes: nerve damage, blood vessel deterioration, slow healing. Many of these have persistent inflammation at their core. Vitamin D helps keep the immune system from staying in a state of constant low-level activation against the body's own tissues. When D is low, that regulation weakens and inflammation becomes more likely to accumulate and persist. There is also a connection that does not get discussed nearly enough. Some research suggests that adequate vitamin D may help protect the insulin-producing cells in the pancreas from inflammatory damage. The body cannot produce more of those cells once they are gone. So protecting the ones that remain matters enormously for long-term metabolic health. Now, here is why deficiency is so disproportionately common in people with diabetes specifically. First, there is the sunlight issue. Vitamin D is produced when ultraviolet light from the sun reaches the skin, but many people with diabetes, particularly those dealing with fatigue, neuropathy, or other complications, spend less time outdoors. And when they are outside, they may be covered up or wearing sunscreen, which significantly blocks vitamin D production. Second, body composition plays a role. Vitamin D is fat-soluble, meaning it gets stored in fat tissue. Research suggests that in people carrying more body fat, vitamin D can get sequestered there and become less available for the rest of the body to use. The stored fat essentially holds it. Third, kidney conversion. The kidneys are responsible for converting vitamin D from its storage form into the active form the body can actually use. Diabetes affects kidney function over time, and as kidney efficiency declines, that conversion becomes less reliable. A person may have vitamin D in their system, but lack the ability to activate it properly. Fourth, skin pigmentation. People with darker skin produce vitamin D less efficiently from sunlight because the pigment called melanin in the skin reduces how much ultraviolet light can penetrate to where vitamin D is made. For many people, several of these factors are working against them simultaneously. The symptoms of vitamin D deficiency are easy to overlook: persistent fatigue, generalized muscle weakness that makes everyday physical tasks feel harder than they should, low mood, sometimes described as a kind of flatness or sadness with no clear cause, getting sick more frequently, or taking longer to recover from minor illnesses, bone or muscle aches, particularly in the lower back, hips, and legs, poor sleep, quality, and in more advanced deficiency, a softening of the bones that causes a deep, dull aching that many people mistake for arthritis or general aging. For food sources, fatty fish like salmon, mackerel, and sardines are among the best dietary sources. Egg yolks contain small amounts. Many dairy products and plant-based milks are fortified with vitamin D. Beef liver provides some, but the honest reality is that food alone is rarely sufficient to correct a deficiency once it has developed. Sunlight is also inconsistent based on geography, season, skin tone, and daily routine. That is why supplementation is often necessary, and the form matters. Vitamin D supplements come primarily as D2 and D3. D2 is the plant-based form. D3, which is more commonly derived from animal sources, is consistently shown in research to be more effective at raising and maintaining blood levels of vitamin D over time. There is also an important pairing that many people are never told about. Vitamin D works closely with vitamin K2. When you take supplemental vitamin D, it increases the body's absorption of calcium from food. Vitamin K2 acts like a traffic director, guiding that calcium into the bones and teeth where it belongs, rather than allowing it to deposit in the walls of arteries and soft tissue. This is why many practitioners now recommend taking D3 and K2 together, particularly at higher doses. The two work as a pair. If you have not had your vitamin D level tested, ask your doctor specifically for a 25-hydroxy vitamin D test. That is the correct marker for assessing stored vitamin D in the body. Many people with diabetes are surprised to find they are well below the range, associated with optimal function. Now, here is where we need to go deeper because it is important, as vitamin D is. It is not the deficiency that concerns me most in people with long-term diabetes. The one that concerns me most attacks the nervous system directly. And millions of people taking one of the most commonly prescribed diabetes medications may be slowly developing it right now without ever being warned. That brings us to vitamin B12. Let me explain what B12 actually does in the body, because most people do not fully appreciate how central it is to daily function. Vitamin B12 is essential for maintaining what is called the myelin sheath. Think of that as the protective coating that wraps around each nerve fiber, the same way rubber insulation wraps around an electrical wire. That coating is what allows nerve signals to travel quickly, cleanly, and accurately from your brain to your body and back to you without adequate B12. That protective coating begins to thin and degrade, and when it does, nerve signals slow down, they misfire, they become inconsistent. The result is exactly what so many people with diabetes describe: tingling in the feet, burning sensations in the legs, numbness, a feeling of walking on uneven or padded ground, weakness in the legs, poor balance and coordination, cold feet even in warm environments. These symptoms are widely attributed to diabetic neuropathy, which is genuine nerve damage caused by sustained high blood sugar. And in many cases, that is exactly what it is. But here is what gets missed far too often. B12 deficiency produces symptoms that are nearly identical to diabetic neuropathy. Nearly identical. And if that underlying B12 deficiency is never identified, the nerve symptoms can worsen or fail to improve even when blood sugar is being carefully managed. Some people are experiencing nerve symptoms that could at least partially improve with B12 correction, but they are never tested, so they never know. And years go by. And then there is the medication piece that I need you to pay very close attention to. Metformin is one of the most widely prescribed medications for type 2 diabetes. Millions of people take it every day, many for years or even decades. Research, including long-term studies following thousands of patients, has clearly established that metformin reduces the absorption of vitamin B12. Here is how it works. Normally, B12 from food binds to a protein produced in the stomach called intrinsic factor. That combination then travels to the small intestine where B12 gets absorbed into the bloodstream. Metformin appears to interfere with this binding process, reducing how much B12 actually makes it through into the body. The longer someone takes metformin and the higher the dose, the more significant this effect tends to be. And what is so troubling about this is that most patients are never told. Most patients are never informed that the medication they are taking long-term has a well-documented effect on B12 levels, or that their levels should be monitored regularly as a result. Instead, people take metformin for years. Their B12 quietly falls. Their nerve symptoms gradually worsen. And everyone assumes it is just the diabetes progressing naturally. Sometimes it is, but sometimes there is a correctable component sitting right there, completely unrest. There is something else worth understanding about how B12 deficiency develops over time because it does not happen suddenly. The body stores B12 in the liver. Those liver stores can last for several years before they run low. So a person could take metformin for 2, 3, even 4 years before their B12 drops to a level where symptoms begin to appear. By the time symptoms show up, the deficiency is often already quite significant. And because the decline happens so gradually, people adapt to feeling that way. It becomes their new baseline. They stop recognizing the symptoms as something worth reporting. The fatigue feels normal. The tingling feels like just part of having diabetes. The mental slowness feels like aging. This is exactly why routine B12 testing matters, not just testing when something feels obviously wrong. If you have been on metformin for more than a year, please bring this up with your doctor at your next appointment and ask to have your B12 tested. It is a straightforward, inexpensive blood test, and what it reveals could meaningfully change your situation. Now, let us look at the full range of symptoms that B12 deficiency can cause, because they go well beyond just the feet. Tingling, burning, or numbness can appear in the feet, hands, legs, and sometimes even around the mouth or face. Muscle weakness and reduced grip strength, balance problems, and a higher risk of falls, which is especially important for older adults. And then the cognitive effects, which are significant and chronically underestimated: brain fog, difficulty concentrating on even simple tasks, short-term memory problems, a feeling that your thoughts are moving through mud. In older adults especially, B12 deficiency can produce changes that closely resemble the early stages of cognitive decline. Research has found associations between sustained low B12 and measurable loss of brain volume over time. Mood is also directly affected. B12 is required to produce serotonin and dopamine, which are the chemical messengers that regulate how we feel emotionally day to day. When B12 is chronically low, depression and anxiety become more likely, not because of circumstances, but because the brain does not have the raw materials it needs to maintain emotional balance and fatigue. Again, deep, persistent fatigue that does not respond to sleep, because B12 is essential for producing healthy red blood cells. Without enough B12, the red blood cells that form are too large and do not work correctly. They cannot carry oxygen efficiently, so every system in the body runs at reduced capacity, chronically low on the oxygen that cells need to function. For food sources, B12 is found almost exclusively in animal foods. Beef, lamb, and pork are reliable sources. Clams and mussels are among the single highest sources of B12 of any food in existence. Salmon, tuna, sardines, and trout provide excellent amounts. Eggs and dairy products, including cheese and yogurt, are also good sources. For people following fully plant-based diets, B12 cannot reliably come from food alone. Supplementation is essential, not optional. Now here's the detail I mentioned earlier that most people never hear. Not all B12 supplements are created equal. The majority of standard B12 supplements contain a form called cyanocobalamin. The body has to convert this synthetic form into an active form called methylcobalamin before it can use it. For younger healthy people, that conversion is usually fine. But in older adults, in people with diabetes, and particularly in people taking metformin, both the absorption and the conversion of cyanocobalamin become less efficient. So people taking a B12 supplement every day may still have low active B12 levels in their body because they are taking a form their system cannot effectively process. The preferred form is methylcobalamin. Methylcobalamin is already in the active form. The body can use it directly. It does not require conversion. Research suggests it is also better retained in tissue and may be particularly effective for nerve health and brain function. There's also the matter of how B12 is delivered because metformin interferes with the normal stomach absorption pathway for B12. Standard tablets that rely on digestion may not work as well in this population. Sublingual B12, meaning tablets or drops that dissolve under the tongue, allow B12 to absorb directly into the bloodstream through the tissue in the mouth, bypassing the stomach entirely. For people with severe depletion, B12 injections may be the most effective option. They bypass digestion completely and deliver B12 directly into the system at full strength. This is a conversation worth having with your doctor if your levels test significantly low. Many people report improvements in mental clarity, energy, and nerve sensations before they see meaningful changes in blood sugar markers, because nerves and brain cells respond relatively quickly once they are finally receiving what they have been missing. Now, I want to be direct about something. This is not about abandoning your medications. Metformin and other diabetes medications serve an important and well-demented purpose. Nothing here is a suggestion to stop taking them. What this is about is making sure that if you are taking a medication with a known nutritional side effect, you have the information to address that side effect. You deserve to know the complete picture of what your medication does, including the parts that do not always come up during a standard appointment. Now, we arrive at the third deficiency, and this is the one that surprises most people. It is not discussed as widely as vitamin D or B12 in the context of diabetes, but the research connecting it to metabolic health, cardiovascular protection, and brain function is substantial. We are talking about folate, also known as vitamin B9. Folate is perhaps most well known for its role in pregnancy, where adequate levels are essential for preventing certain birth defects, but its role throughout the rest of the lifespan is just as important and far less recognized. Folate is essential for cell growth and repair. Every time the body needs to create a new cell to heal a wound, to replace the rapidly turning over cells that line the gut, to produce new red blood cells, folate is a required ingredient in that process. Without enough folate, cell production slows and the quality of those new cells declines. But the most directly relevant function of folate for people with diabetes involves something called the methylation cycle. Methylation is a process that happens billions of times per day throughout the body. It is involved in repairing DNA, producing brain chemicals, regulating how genes are expressed, and managing a molecule called homocyan. Let me explain homocyan because this is where things become very directly relevant to cardiovascular health and diabetes. Homocyan is an amino acid that the body produces naturally as a byproduct of normal metabolism. Under healthy conditions, the body uses folate along with B12 and B6 to convert homocyan into harmless compounds that the body can safely clear. But when folate levels are low, that conversion slows down. Homocyan builds up in the bloodstream. An elevated homocyan is genuinely damaging to blood vessels. It erodes the inner lining of arteries. It promotes inflammation within the vessel walls. It makes the blood more prone to forming clots, all of which significantly increases the risk of heart attack and stroke. Now consider why this matters so specifically for people with diabetes. Diabetes already places the cardiovascular system under considerable stress. Blood sugar fluctuations, insulin resistance, and chronic inflammation all contribute to an elevated baseline risk of heart disease and stroke in people with type 2 diabetes. When you layer chronically low folate and elevated homocyan on top of that, the cardiovascular risk compounds in a way that most patients are never warned about. Studies have consistently found that people with type 2 diabetes tend to have lower folate levels compared to healthy controls, even when their diets look similar. One major reason is kidney function. As diabetes affects the kidneys over time, the kidneys become less efficient at retaining folate and more of it is lost through urine on a daily basis. And there is the medication connection again. Metformin has been shown in several studies to also reduce folate absorption in some people. This means someone on long-term metformin may be quietly running low on both B12 and folate at the same time, which creates compounding problems because the body needs both of them for the methylation process to work correctly. Now, let us look at what folate deficiency can cause. Fatigue and weakness are common because folate is needed for healthy red blood cell production. Low folate leads to a form of anemia that leaves the body running on reduced oxygen. Mouth sores, a sore tongue, or an inflamed lean tongue are classic physical signs of folate deficiency that many people do not recognize as being nutrition-related. Mood instability and depression. Folate is involved in producing serotonin, and deficiency is associated with higher rates of low mood and depression. Difficulty concentrating and mental slowness. Folate supports brain function across multiple pathways, and sustained low levels are linked to cognitive difficulties and elevated homocyan, quietly compounding cardiovascular risk in the background, often with no obvious symptoms at all until a serious event occurs. For food sources, folate is found in highest concentrations in dark leafy greens. Spinach, kale, romaine lettuce, arugula, and Swiss chard are excellent choices. Legumes are also very high in folate, particularly lentils, black beans, chickpeas, and kidney beans. Asparagus, broccoli, avocado, beets, and Brussels sprouts all contribute meaningful amounts. Eggs and citrus fruits are additional sources. Here's a practical cooking detail that genuinely changes how much folate your meals provide. Folate is highly sensitive to heat and water. When you boil leafy greens for a long time, you can destroy a large portion of the folate before it ever reaches your plate. The heat breaks it down, and the water carries it away. Lightly steaming, roasting, or eating vegetables raw preserves significantly more of the folate content. A spinach salad gives you considerably more folate than the same amount of spinach boiled down into soup. Raw avocado on its own gives you more than avocado that has been heated. When you are already at elevated risk for deficiency, preserving what you eat matters more than most people realize. For supplementation, folate comes in two primary forms. Folic acid is the synthetic form found in most standard supplements and used to fortify many processed foods. Methylfolate, also written as 5-MTHF, is the active form. Here is why the form matters, and this is genuinely important information. A significant portion of the population carries a genetic variation called MTFR. Some estimates suggest this affects anywhere from 30 to 45% of people. This variation reduces the body's ability to convert folic acid into its active, usable form. People with this variation who take standard folic acid every day may be supplementing consistently and still not correcting their deficiency because their body cannot efficiently process the form they are taking. Methylfolate is already in the active form. The body can use it directly. This is why many practitioners working in metabolic and preventive health now recommend methylfolate over folic acid, particularly for older adults and people with diabetes. Now let us step back and look at all three together. Vitamin D, vitamin B12, folate, each plays a distinct role. Vitamin D for insulin responsiveness, immune regulation, and inflammation control. B12 for nerve health, brain function, mood, and red blood cell production. Folate for cell repair, cardiovascular protection through homocyan management, and brain chemistry support. But these three are not completely separate. They interact with each other. B12 and folate work together in the methylation cycle. When one falls low, the efficiency of the other drops too. And both are needed to keep homocyan at safe levels, which protects the cardiovascular system. Vitamin D influences immune and inflammatory pathways that affect how the body handles metabolic stress. And those same pathways affect how efficiently nutrients are absorbed and used throughout the body. All three share overlapping effects on energy, mood, and brain function. When any one of them is low, it adds burden to the other systems. When more than one is low simultaneously, the combined effects are significantly greater than any single deficiency alone. This is also why a standard general multivitamin is rarely sufficient. Most multivitamins contain relatively low doses of these nutrients, and frequently in the forms that are harder for the body to use. Folic acid instead of methylfolate, cyanocobalamin instead of methylcobalamin, D2 instead of D3. The label can look reasonable while the actual nutritional impact is minimal. The difference between a form the body can readily use and one it struggles to convert can be the difference between a supplement that genuinely helps and one that does essentially nothing, even when taken consistently every day. Now let me talk about reading supplement labels because this is where people make costly mistakes without realizing it. When you pick up a B12 supplement, turn it over and look at the actual ingredients list. If it says cyanocobalamin, that is the less preferred form. Look for methylcobalamin instead. For FOL, if the label says folic acid, consider looking for a product that says methylfolate or 5-MeAdHef. These are different names for the same active form. For vitamin D, confirm it says D3, not just vitamin D, which may mean D2, and check whether K2 is included or whether you will need to take that separately. These label differences cost very little to change, but they can make a meaningful difference in how much your body actually absorbs and puts to use. Now let me talk about the connection between these three deficiencies and something that affects nearly everyone with diabetes, but rarely gets discussed in this context: sleep. Poor sleep is one of the most common and draining complaints among people with diabetes. Difficulty falling asleep, waking multiple times through the night, waking in the early morning unable to fall back to sleep, lying in bed for hours, and waking up feeling no more rested than when you lay down. While there are many reasons for disrupted sleep in diabetes, nutrient deficiencies contribute more than most people are ever told. Vitamin D has receptors in areas of the brain that directly regulate the sleep-wake cycle. Studies have consistently found that people with low vitamin D levels report significantly worse sleep, including more nighttime waking and less time in the deep restorative stages of sleep that are responsible for physical recovery and memory processing. B12 plays a direct role in the production of melatonin, which is the hormone your body releases in the evening to signal that it is time to sleep. When B12 is low, melatonin production becomes irregular and unpredictable, making it harder to fall asleep at a consistent time and harder to stay in the deeper stages of sleep through the night. Folate, through its role in producing calming neurotransmitters, affects how easily the nervous system can shift from a state of alertness and arousal into the quiet, relaxed state that allows for restorative sleep. Low folate is associated with a kind of mental restlessness that makes winding down feel difficult even when the person is exhausted. So if poor sleep has been one of your persistent struggles, and you have been attributing it entirely to blood sugar fluctuations, frequent urination at night, or stress, it is genuinely worth considering whether these nutritional gaps are also contributing, and better sleep when it comes feeds back powerfully into everything else. Better sleep supports more stable blood sugar regulation. It lowers cortisol levels, which reduces the nutrient drain we talked about earlier. It improves mood, cognitive function, immune response, and energy throughout the day. These systems genuinely support each other in both directions. Now, let me give you a clear, practical starting point for the next 30 days. 1. Shift your meals toward nutrient-dense foods consistently. Dark leafy greens, legumes, fatty fish, eggs, nuts, and seeds. This does not have to be perfect. It does not have to be a complete overhaul, but making these foods a consistent presence rather than an occasional addition gives your body the raw materials it can actually work with day after day. 2. Get daily morning sunlight when you can. Even 10 to 20 minutes of outdoor time with some skin exposed, ideally arms or legs, supports vitamin D production and also helps regulate your internal body clock, which directly affects sleep quality and energy patterns. A short morning walk achieves both at the same time. 3. Change how you cook your vegetables. Steam or roast instead of boiling when possible. Add raw spinach to smoothies. Use greens in salads. Eat avocado as it is. These small preparation changes preserve significantly more of the folate that would otherwise be lost in water and heat. 4. Check the form of every supplement you currently take. Look at the ingredient label, not just the front of the bottle. If your B12 says cyanocobalamin, consider switching to methylcobalamin. If your folate says folic acid, consider switching to methylfolate or 5-MeTHF. If your vitamin D says D2 or just vitamin D without specifying, look for a D3 product, ideally one that includes K2. 5. Schedule the blood tests. At your next appointment, specifically ask for your 25-hydroxy-vitamin D level, your serum B12, your folate level, and if possible, your homocyan. You do not need to frame this as a challenge to your doctor. Simply say you have been reading about nutritional status and diabetes and you would like to have a baseline. Most physicians are genuinely receptive to that kind of engaged, specific request from a patient. 6. Track how you feel over the weeks that follow. A simple note on your phone works perfectly. Your energy in the morning, whether the tingling in your feet is changing, how clear your mind feels by mid-afternoon, whether your mood feels more stable, whether sleep is becoming more restorative. These subjective shifts often begin before blood tests fully reflect them. Your body responds to what it receives. When it starts getting more of what it needs, it notices before the numbers catch up. Now, I want to say something that I think matters deeply, and that goes beyond the practical information. Living with diabetes is exhausting in ways that go beyond the physical. There is the constant mental load of monitoring, counting, calculating, adjusting. Every meal, every activity, every day, often for years or decades. There is the emotional weight of managing a chronic condition that society sometimes treats with judgment rather than understanding. And there is the particular frustration of doing everything you are supposed to do and still not feeling well. If any of that resonates with you, please hear this. You have not failed. Your body has been under a form of ongoing metabolic stress for years. It has been working hard, and sometimes, despite all of your effort and care, it needs more support than glucose management alone can provide. That is not personal failure. That is a more complete picture of a complex condition that affects nearly every system in the body. And the fact that you are here watching this, asking better questions, seeking more information, that matters. That kind of engaged self-advocacy consistently leads to better outcomes over time. Small corrections made consistently compound into meaningful change. I want to leave you with something I tell patients who feel like they have been running in place for too long. Getting older does not mean your body has to feel broken. Living with diabetes does not mean decline is inevitable. Your body is remarkably capable of responding when it finally has the right support. There are no guarantees. I am not promising that correcting these deficiencies will resolve every symptom or challenge you are dealing with. Diabetes is complex and it requires comprehensive care. But I am telling you that nutritional status is a real documented and consistently overlooked piece of that care. And many people, once they address these deficiencies, with the right forms, the right testing, and the right consistency, feel noticeably better in ways they had genuinely stopped expecting. You are not too far gone for improvement. Your body is still responding, still trying, still capable of feeling better than it does right now. Give it what it needs, and pay close attention to what it tells you. If you found this helpful and want to keep learning about managing diabetes through science-based nutrition, metabolic health, healthy aging, and long-term wellness, there is a longevity guide linked in the description below. It builds on what we covered today and gives you a more complete roadmap to work from. And if there's a symptom you are dealing with or a question this video raised for you, leave it in the comments. I read everyone, and your question may become the foundation of a future video that helps someone else going through the exact same thing. Take care of yourself, and I will see you in the next one.